This is the model of breast, showing its anatomy and the lymphatic drainage. As far as the gross anatomy is concerned, breast, it lies in the superficial fossa of the pectoral region. This is in gray color. This is the superficial fossa, and this is the breast. The extent of the breast, it extends from the second, this is the xiphisternum, this is the manubrium sterni, this is the body of the sternum. So this level is the second costal cartilage. So second, third, fourth, fifth, sixth, second to sixth rib, vertical extent, and horizontal extent from the lateral sternal border up to the mid axillary line. And the nipple, it lies in the fourth intercostal space. This is the second. So below the second, this is the second intercostal space. This is third, and this is fourth intercostal space. It lies in line with the nipple. Okay. Now coming to the, it is a modified sweat gland. The breast is as well as it is an important accessory reproductive gland. It is of apocrine. As far as the mode of secretion is concerned, it is apocrine in nature, as the secretory cell secretes only the apical part as the product of secretion. Okay. This is the axillary tail. The breast, it has got axillary tail which pierces the deep fossa. This white one is the deep fossa. It pierces the deep fossa through an opening. This green one, this is the foramen of Langer, and going up to the third rib. This is second, this is third. So in line with the third rib. Okay. Now it lies over the fat. Behind this there is a fat, then fossa, and then pes muscle, that is the pectoralis major, this one in green color, then external oblique abdominis, and the serratus anterior. Okay, pes. Now as far as the lymphatic drainage is concerned, first we will discuss the gross anatomy in detail, that is, and this is the areola, which contain a modified sebaceous gland which become very enlarged during the pregnancy and lactation, and this is known as Montgomery tubercle. Okay, and as far as the histology is concerned, it is made up of, if we cut the section of a breast, what we will see, that there are the parenchyma and the stroma. This is the skin, areola, nipple, and in the cut section there is parenchyma and stroma. Parenchyma is comprises of secretory lobule. These are the secretory lobule in green, and this secretory lobule is this red color. Okay, and these are the branching duct. These are all duct, the branching duct, and this in red color, these are the secretory lobule. Okay, there are 15 to 20 lactiferous duct gathered in the nipple, and they have got separate opening, and these are the one. This is the secretory lobule, and this is one lobule, and I have made only one lobule, and this is the fibrous stroma. In between the two lobule there is fibrous stroma and the fatty stroma. This is the fibrous stroma, fibrous septa, in between which anchors this breast to the pectoral fossa. Okay, this is the, in white color, this is the pectoral fossa, this one. So it adhere the breast and there is this is also known as suspensory ligament of Cooper, which has got very great clinical significance, as in it becomes shortened in case of breast carcinoma, and the reason why the skin so puckered appearance, there will be puckered appearance. Okay, and these are the fatty stroma. The fat lobules are present in between the secretory lobule and the branching duct, and is the main bulk of the breast. Okay, now coming to the lymphatic drainage. The lymphatic drainage, it is the 75% of the breast tissue, 75% breast tissue is drained into the axillary group of lymph node. Axillary group of lymph node, they are divided into 5 variety, 1, 2, 3, 4 and 5. This is anterior group of axillary lymph node, which lies in between the pectoralis minor and pectoralis major. This is pectoralis major and this is pectoralis minor. In between these two, this is anterior group of axillary lymph node. Just above the pectoralis minor, this is the apical group of axillary lymph node. This is axillary vein and by the side, but above the pectoralis minor. Below the pectoralis minor, this is the central group of axillary lymph node. And again, this is also axillary vein, but near the bone. This is humeral or lateral group of axillary lymph node. And this is near the subscapular vein. This is the subscapular vein. This is the tributary of axillary vein formed by the thoracodorsal and circumflex scapular vein when unite to form the subscapular vein. Circumflex scapular and thoracodorsal. Now, by the side of the subscapular vein, in the posterior axillary fold, this is anterior axillary fold, this one, and this is the posterior axillary fold. In the posterior axillary fold, there lies the posterior group of axillary lymph node. So these are 5. This is anterior, okay, or pectoral, anterior or pectoral group of axillary lymph node. This is apical, this is central, this is humeral or lateral, and this is posterior group of axillary lymph node. And another one is this is internal thoracic vein. This is internal thoracic vein, which is the branch of the brachiocephalic vein. This is our superior vena cava. This one is superior vena cava, divided into the right brachiocephalic and the left brachiocephalic, which divides into the internal jugular vein and the subclavian vein. After the outer border of first rib, this is the axillary vein. Okay, this is the axillary vein. So, the brachiocephalic vein gives internal thoracic vein. By the internal thoracic vein, these are the internal thoracic lymph node or parasternal lymph node. Okay, and so how the drainage occur? The nipple and the areola is drained by the subareolar. This is areola, and beneath that, this is the subareolar places of lymphatics. The areola and the nipple drained into the subareolar lymphatic plexus. Then if we take the quadrant, if we divide the breast in 4 quadrants, this is upper and outer, this is lower and outer, this is upper and inner quadrant, this is lower and inner quadrant. So upper and outer quadrant, and also from the lower and outer a little bit, they are going to the apical group of lymph node, this apical group of lymph node, then this is the central group of lymph node, central group of lymph node, this thing, central group of lymph node, and this is the lateral group of lymph node, these three from the upper and outer quadrant. Then lower quadrant, it drains into the lateral group of lymph node. This is the lateral group of lymph node. From the posterior aspect of the breast, posterior aspect, it is going to the posterior or subscapular group of lymph node. Okay, this is, here we can see, this is the posterior subscapular group of lymph node. The posterior one is going here. Okay, now upper and the inner quadrant, they are going to the sternal, which is by the side of the internal thoracic vein, and the lower and inner quadrant, they are going where? To the mediastinal group of lymph node. This is the mediastinal group of lymph node. Mediastinum is what? The cavity of the thorax in the middle, in between the two lungs. So it going to the mediastinal group of lymph node, and also going, this is the inferior vena cava, this is the inferior vena cava, and through the caval opening, this is the diaphragm, going to the abdominal lymph nodes. Okay, this is inferior vena cava. So the lymphatic drainage we have discussed, upper and outer, going to the apical, central, as well as the lateral. The lower and outer going to the lateral. From the posterior aspect, going to the posterior group of lymph node. From upper and inner quadrant, going to the paraesternal lymph node or internal mammary lymph node. And this is or internal thoracic. And the lower and inner quadrant going to the mediastinal lymph node, as well as through the caval opening going to the abdominal lymph node. Okay, so this is more dangerous, lower and inner quadrant, because they are going at far places. If there is a carcinoma, breast cancer is very common in India. It is the most common cancer in the women. Previously it was cervical cancer, but nowadays it is breast cancer. And we all know that the cancer is spread through the lymphatics. So, and from the apical, this if there is a carcinoma, so carcinomatous tissue is spread through apical to the supraclavicular, and then this is the superficial cervical lymph node, which lies by the side of the external jugular lymph node. This is external jugular lymph node. I mean external jugular vein. External jugular vein, which is formed by this is parotid gland. Within the substance of the parotid gland, this is retromandibular vein, which divides into the anterior and posterior division. Posterior division united with the posterior auricular vein to form the external jugular vein, which drain into the subclavian vein. So the metastasis, if there is a breast cancer, it will spread from apical to the supraclavicular. This is the lymphatic. Then the superior cervical lymph node, and there is parotid lymph node. So the parotid lymph node will be more vulnerable compared to the submandibular and the sublingual lymph node as far as the salivary gland is concerned. And it will, mostly the breast cancer is common in the upper and outer quadrant. But if there is upper and inner quadrant, it will also, there is a connection in between the two paraesternal lymph node behind the sternum. This lymphatics passes to the contralateral side. So if one breast is involved, then contralateral breast will get involved with the time. Okay, so we have to examine both breast. If the patient come with unilateral breast carcinoma. Okay, now the inner and the lower, it will metastasize far in the abdominal and the mediastinal lymph node. So it is also very dangerous. And sometime the inferior vena cava, in which the right side gonadal vein open, and inferior vena cava give rise to renal vein, in which left gonadal vein open. This gonadal vein is going to the drains the ovary. So in some time the Krukenberg tumor occur, which is secondary to the breast carcinoma. Krukenberg tumor most commonly is secondary to the gastric carcinoma in the pylorus gastric adenocarcinoma, but it can also be secondary to the breast carcinoma. Okay, so this is all about the lymphatics. As far as the arterial supply is concerned, it is supplied by PIA. One thing more, in case of lymphatic, the internal thoracic vein, this is sternal lymph node which lies by the side of the internal thoracic vein, has connection with is one of its tributaries, anterior intercostal vein. Anterior intercostal vein anastomosis with the posterior intercostal vein. Posterior intercostal vein drains into the vertebral venous plexus. They are going to the basilar venous plexus and then to the cavernous sinus. So it will this breast carcinoma will metastasize even to the head and neck, as cavernous sinus will get involved through the internal thoracic to the anterior intercostal, then to posterior intercostal, and then to the vertebral venous plexus, and then to the basilar venous plexus and to the cavernous sinus, and also going to the pelvic cavity through the internal vertebral venous plexus to the Batson venous plexus, which lies by the side of the sacrum, and then to the pelvic cavity. Okay, so it is very dangerous. Now the arterial supply is PIA, that is the posterior intercostal artery, internal thoracic artery, and the axillary artery. Even vein is PIA, that is the posterior intercostal vein, internal thoracic vein, and the axillary vein. And the lymphatics we have discussed. The cutaneous supply, it is from the 2nd to 6th intercostal nerves, anterior and the lateral branch. Okay. So this is, and one thing more, the clinical significance. Breast carcinoma we have discussed, and also there are benign causes, that is the fibrocystic breast disease or breast mouse, in which upper and outer quadrant also get involved, but it will be mobile. The nodule will fluctuate. If we palpate, then it will fluctuate here and there, and during the menstruation period, there will be breast mestalgia can be there. And regarding the breast development, the breast is developed from the milk line, which is from axilla to the inguinal region. There is one line developed at the 6 to 7 week of intrauterine life from axilla up to the inguinal region. That is called the milk line or line of Schulz. But only in the pectoral region, it is ectodermal in origin. Ectodermal ridge appear from here to here. That is called milk line or line of Schulz. Only the pectoral region, the milk ridge will develop into the breast tissue. And this is done by the top gall transgene and also the TBX3 gene and fibroblast growth factor 10. Okay. And regarding the clinical significance, breast carcinoma, fibrocystic breast disease, breast mestalgia, and also there are many congenital causes. There is this, if there is too many breast tissue along the milk line, mostly in the axillary region. So that is supernumerary polymastia, that is called polymastia. And if there is many more nipple, one breast but many nipple, that is called polythelia. If there is no breast tissue, that is called amastia. And if there is breast development more in the male, then it's called gynecomastia. Okay, so this is all about the breast. Thank you.